So today we are going to talk about NIHS score. We have started a series of videos on scores in stroke. Okay, so today our topic of discussion is NIHS, and it is very important that as a house officer, as a doctor, as a general practitioner, or as a trainee, you must know what is NIHS score. So let us explain this score. So our series of videos on scores in stroke. Today our topic is NIHSS. As I already uploaded a video on transient ischemic attack in which we find ABCD2 score, and in ischemic stroke we find aspect score and NIHS score. I already uploaded video on aspect score. In subarachnoid hemorrhage we find HNH and MFS classification, and intracranial bleed we find ICH score. So I uploaded videos on all these topics, and today our last videos on score in stroke, and this is very important. We will be talking about NIHS score. So NIHS, we can say National Institute of Health Stroke Scale. So this means NIHS score. Now definition of NIHS is, it is a systematic assessment tool designed to measure the neurological deficit. Most oftenly we find it in acute stroke. It's mean that as I already say, that in ischemic stroke radiologically the damage we detect it by aspect score, and the damage which is caused by ischemic stroke on examination we find it by NIHS. Okay, so the uses of this: objectively quantify the impairment caused by stroke, I mean the ischemic stroke; quantitative measure of stroke related neurological deficit. The neurological deficit which is caused by ischemic stroke will show us, we show that on NIHS score, and which will tell us that is the stroke or the deficit is more severe or moderate or minor. So the number is from 0 from 42. 0 is minimum, 42 is maximum. When the score is 0, it's mean no stroke. When the score is from 1 to 4, this is minor stroke. When the score is from 5 to 15, that is moderate score. When the score is 16 to 20, that is moderate severe stroke. And if the score is 21 to 42, that is severe score. Now the benefits of NIHS score is it actually evaluate the severity of the stroke. As I say, if the score is 1 to 4, that is minor stroke. 5 to 15 moderate, like more 21 to 42, that is severe. So it evaluates the severity of the stroke. It also predicts the outcome of the patient. If the score is high, the outcome is not good, but if the score is minor, the outcome is good. It also monitor the progress, क्वान्टिफाई देयर इम्प्रूवमेंट और डिक्लाइन. सो प्रोग्रेस को भी ये हमारे साथ शो कर देता है. अगर डे बाय डे NIHS ज़्यादा हो रहा है तो इट्स मीन के इट इज़ डिक्लाइनिंग, द पेशेंट इज़ गोइंग टू मोर डेफिसिट. और अगर डे बाय डे if the NIHS score is decreasing, it means that the patient is improving. So the last one is, it helps us determine the appropriate treatment. It is very important, because on the base of NIHS score we will decide either we should give TPA or not, and we should also decide that we should give single antiplatlet or double antiplatlet. For TPA, if the NIHS is more than 5, then or 5 or more than 5, we give TPA. Okay. And if the NIHS is less than 5, we don't mostly give TPA, but if the patient is having some disability like aphasia, then we can give TPA. Now for this is very important to decide the antiplatlet. If NIHS is from 1 to 4, then we should give double antiplatlet like clopedegral plus, and which there is aspirin and clopedegral. So you see here, this is clopedegral plus, clopedegral and aspirin. So if the NIHS score is from 1 to 4, give double antiplatelets for 21 days, and then shift to single antiplatelet. But if NIHS is more than 5, then we give single antiplatelet like clopidogrel 75 mg aspirin. Only we give aspirin, and we don't give clopedegral as a single antiplatelet, because many of the Asian country people are they are resistant to the clopedegral. So the single antiplatelet we should give aspirin, that is clopidogrel 75 mg OD. Okay, so this is how it's very important that we should understand the NIHS score. On the base of NIHS score we give single antiplatelet or dual antiplatelet. NIHS score, this is going to be opposite. Like if the score is less than 5, it's mean the patient having less the patient having less focal deficit, so we have to protect the patient from more deficit. That's why we will give the low plate plus for 21 days, clopedegral plus aspirin for 21 days, and then we will shift to single antiplatelet. But if the score is equal to 5 or more than 5, it's mean the patient having more focal neurological deficit. So then for that we cannot do anything, like we can give TPA or we can do mechanical thrombectomy or whatever. But still, if the score is 5 or more than 5, then we will give single antiplatelet, that is aspirin or loprin. You guys have to download the medical calculator and then open this medical calculator. Here you guys can see NIHSS. Just search it. You open NIHSS now. Just see level of consciousness. Just put what is the level of consciousness, then ask about month and age, which one question or two question is right. Then also let us see his blinks eyes or not, extraocular movement of eye, check it. Then also check visual field, and then check facial asymmetry if there is any, and the power of left side of the upper and lower limb and right side of upper and lower limb, and put it. Then check the limb ataxia if there is, and then check up sensation, this dysarthria, all these check up, and then they will give you the total value, like for this 14.